Hi, I'm Kim Glover. I am a PhD student at the George Institute for Global Health and a dietitian by training.
The George Institute for Global Health is a global organisation aiming to improve the health of everyone in the world, especially focused on helping people from disadvantaged communities, including low and middle income countries.
My PhD project is based on food is medicine, particularly produce prescription. So produce prescription means that we provide fresh produce to people who say have diabetes or cardiovascular disease. The focus for my PhD is type 2 diabetes and gestational diabetes. These programs are generally focused on people who are food insecure, so we can help to support them in accessing the types of foods that they need to deal with their diet-related conditions.
The work we're doing as part of Kim's PhD around produce prescription for people with food insecurity fits really well into the mission of the George Institute, and we really would love to see produce prescription implemented not just in Australia but in low and middle income countries as well.
When we think about food insecurity, we assume that it just means that people can't afford to buy food and they're going hungry. However, it's a little bit more nuanced than that. Maybe they just can't afford to buy healthy foods, so they're substituting whole grains for refined grains, or really high quality meats for meats that are highly processed, or they're compromising on quantity, so they're just not being able to satisfy the amount of calories that they need per day. 91% of Australians do not eat enough vegetables, 55% do not eat enough fruit. So that's a lot of fruit and vegetables that are going uneaten at the moment. If we're providing fresh produce to people who have trouble accessing food, it's a lot more food that's going to be eaten. It's going to improve health overall for the average Australian, and maybe go some way to cutting down food waste in Australia. So I think it's going to benefit the food and beverage sector and the whole food system here in Australia.
Our produce prescription trial for type 2 diabetes is currently in recruitment phase. Our target sample is 224 participants, and we hope to recruit the rest of our sample by the end of this year or early 2026. So that means we're going to have results for the trial mid next year, which is really exciting. So we'll be able to have some data on how effective this type of intervention is for improving the health of people with type 2 diabetes. So in Australia, 125 people are diagnosed with type 2 diabetes every day. And so our Australian healthcare system's overburdened with people with type 2 diabetes and trying to care for them. So our hospitals have been really keen to get on board with this trial. They see a need for people with food insecurity and type 2 diabetes, and so this program is really going to help these people. So the support from the hospitals has been great. They see the need, they want to be on board, and then the participants themselves want to sign up. So that's why we've been able to recruit really quickly to this trial, because there's just a real interest in being part of this research.
Produce prescription is a relatively new area of research in Australia. Thus far, it hasn't been tested in an Australian setting. That's why we're doing what we're doing, to show that something like produce prescription, where we're actually focusing on preventative health and diet-related diseases and trying to support people to access healthy foods, we want to see if that works here. We want to show that it can work here. On this project, we're collaborating with a number of hospital sites, including RPA, Canterbury, Liverpool, Campbelltown and the Nepean Hospital. Our food suppliers for this trial are Harris Farm and Box Divvy. Beyond that, to make the produce prescription and food is medicine dream happen, we have a translational advisory group, and that includes a lot of stakeholders from government organisations, non-government organisations, consumer advisors who have lived experience of type 2 diabetes and food insecurity, and other researchers, particularly the Heart Foundation, Diabetes Australia. None of our research is possible without funding, and we're supported by Future Food Systems.
So the data from this trial is going to enable us to write publications up about our findings, but it's more than that. We also want to use these findings to inform our next research questions and to really drive the scaling up and implementation of these sorts of programs. We'll also use our findings to develop policy briefs and other documents to inform policy and to engage policymakers and other key stakeholders that can really help to drive these findings into a more sustainable, accessible approach to healthcare for millions of Australians.
The ultimate goal is to have produce prescription integrated into the Australian healthcare system.